Hey everyone, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Alyssa McPeak, a doctor of chiropractic and a certified functional medicine practitioner who blends the best of both worlds as a functional medicine chiropractor. Through her practice, Roots Wholistic Health, she specializes in pregnancy, pediatrics, women's health, hormones, and fertility. Her passion for this work is deeply personal after struggling with her own hormone imbalances and endometriosis diagnosis. Dr. Alyssa experienced firsthand how powerful it is to dig deeper and truly understand what's going on in the body, and that journey completely transformed the way she practices today. Now she's dedicated to helping women feel heard, find real answers, and reconnect with themselves while also supporting children through proactive, wellness focused care. Outside the office, you'll find her soaking up time with her husband and her 4 kids, whether that's on the water, in the woods, or at the hockey rink. We're excited to introduce you to her now. Hello, everyone. Welcome back to the podcast. We are excited to be in episode number 3 with Dr. Alyssa. And if you missed our first 2 episodes, these were so informative. Gosh, you are so smart, Dr. Alyssa. We talked primarily about fertility in these first 2 episodes. The first one was about finding your fertility and cycle syncing. So if you've heard that term of cycle syncing, it's really just about optimizing our hormones. And honestly, I feel like that episode really applied to someone, whether they're trying to get pregnant or not. Like, let's just have happy cycles and happy hormones. And then in episode 2, we talked a lot about PCOS, endometriosis, quote unquote, unexplained fertility. Like, what do these things actually mean? And Dr. Alyssa really provided a ton of hope in that episode. But now in this one, we're kind of shifting a little bit into perinatal care. So, positive pregnancy test, here we go. Now what do we do, right? Because this is a whole new learning curve with a whole bunch of new questions happening. And you are an expert in this arena as well. So, I'd love to honestly just start out by understanding what type of people should be in someone's life when someone gets pregnant regarding providers. Like, what should their support system look like, and what kind of questions should they be asking different providers to make sure that they're a good fit for them?
So when I see women that are in their prenatal cycle, they're looking for help and support during their pregnancy, the first question I ask them is, who are you working with? Because your providers that you hire to work for you during your pregnancy are essential to your birth and postnatal outcome. This is crucial because we are people, right? Providers are people. We have opinions, we have views, we have values, and really choosing the providers that align with your values and your goals is key. And I really remind my patients that your provider works for you. You are hiring and paying these people to give you advice. And if you don't like the advice they are giving you, or you don't feel comfortable with their recommendations, you can fire them and look for somebody that really aligns with your beliefs and your values.
Yeah, no, that is a really, really good point. How does somebody, because I feel like a lot of people feel intimidated because, it's a doctor. They don't want to offend people, but like, what are some questions that people really should be asking when it comes to making sure that somebody they're looking at does align with their values and their thought processes?
I think that really depends on what's important to you, right? Because I have women that come into my office that are pregnant and they have a scheduled C-section. And they know, like, this is when I am delivering. And my questions to them are, how can I serve you best, right? How can I make the process up until that point the best experience for you? And really, you know, looking at what those questions are really depend on what you're going through. I really think as a mom that's pregnant, you have different factors in your life, and that might be, you know, if you're having twins, right? If you have a job where you're on your feet all the time, right? Like different factors in that pregnancy really play a part into the support that you need during that pregnancy. And I think the questions that women should ask are the ones that are important to them. And I don't think that is, I don't have, a list for those women, but for me personally, and I can only speak to my experience, but my questions to my providers were, how do you feel about vaginal breech births. That was a question I asked my midwives. Like, will you deliver my baby if it's breech? Will you allow me to do delayed cord clamping? Will you allow me to do skin to skin contact after birth? How do you feel about placenta encapsulation? You know, a lot of women are not allowed to bring their placenta home. And I think, asking those questions to your provider gives you an idea of where their stance is on things. Vaccines are a really hot topic, and I like to educate my moms that, vaccines during pregnancy is something that a lot of providers will push. And if you don't feel comfortable with that, you need to find a provider that's going to support you with your stance and your values. And if you don't want vaccines during your pregnancy, you're entitled to that. And if you do, you're also entitled to that, and find a provider that's going to support you the way that you feel the most comfortable.
I love your perspective here because it's really a mindset shift away from the doctor is in the driver's seat and I need to do whatever they're saying to you're in the driver's seat of this. And so that's really refreshing. So thank you for sharing that with us. So let's kind of go into an overview. Just hearing from you, I mean, you're a chiropractor, so obviously I'm assuming chiropractic would be beneficial during pregnancy, but also being a chiropractor, you are very much into just wellness and natural living and things like that. So what should women be doing to have a healthy pregnancy, whether it's like coming and seeing somebody like you, things that they should be putting into their schedule appointment wise, or just even at home lifestyle wise? What can they be doing to have an optimal pregnancy?
Yes, I think chiropractic care, as a chiropractor, I'm a little biased, but I think it's essential during pregnancy and in all four, I say four trimesters. And we do something in the chiropractic world called the Webster technique, which is a specific technique for pregnancy. We do the Webster technique throughout all three trimesters, but there are specific contacts that we wait until 37 weeks to perform because they can induce contractions, which we don't want to do until after 37 weeks. So, when you are looking for a pregnancy provider, make sure you are asking if they are certified and trained in the Webster technique because that is something that can really help balance the pelvis and the uterus and the round ligaments and allow baby to get into the best position possible for birth. I also recommend that everyone has a prenatal massage therapist. And also, I do think that acupuncture and even pelvic floor PT can be crucial providers during pregnancy care.
Yeah, those are I 100% agree. And for those listening who have not heard about Dre and I, our backgrounds, we're prenatal and postpartum specialized personal trainers. So you're definitely speaking our language right now with everything you're talking about and the people you're recommending to see. What about at-home things that women should really be paying attention to, whether it's the type of exercise that they're doing or the type of nutrition that they're eating or things that they're not doing or that they shouldn't be doing, I guess I should say. What are your thoughts on that?
Yeah, at home, I think getting back to the basics is key. And I talked about this previously where it's being outside, you know, getting that natural vitamin D. Also, movement, right? Finding ways to move every day. And that might look different in the first, second, third, and fourth trimester, but really working with either a trainer or a PT that can help guide you. Even a lot of prenatal chiropractors will give you exercises and movements that are great depending on which phase you are in of your pregnancy. I always recommend yoga. I love prenatal yoga and postnatal yoga. And I think to holding your body in positions where you're stabilizing versus repetitious can be really beneficial for also your pelvic floor because after pregnancy in that fourth trimester, this is where we see a lot of pelvic floor issues if it's not worked on. And I think doing this prior to pregnancy can also help with those muscles that are in charge of pushing your baby out. We always say that we're the ones pushing, but the muscles have to work in order to do it. So maintaining stability in the pelvic floor and the core for me are key to having a healthy and comfortable pregnancy.
What about prenatal vitamins? I know that this is something that you shared with us that you are also passionate about. And so is there what should people be looking for in a prenatal? And then if you have any other nutrition tips as well.
Yeah, I think prenatal vitamins are something that I ask every pregnant patient to either bring in or take a picture of so I can see what they're taking. Not all prenatal vitamins are created equally. And I want women to know that because if you're grabbing a one a day off the shelf at Walgreens, it's not always going to have the quality of the nutrients that you need. And one of the things to look for in your prenatal vitamin is folate. So, folic acid is the synthetic form of folate. And if your prenatal vitamin or your multivitamin contains folic acid, that takes 4 different processes in your body to break down, whereas folate is the natural form and is easy to break down. Also, another trick is to look at your B12 in your vitamin, and this is cobalamin. And if it is not methylated, so it'll say methylcobalamin instead of cobalamin, you need to look for the methylated form of cobalamin because if you are not, or if you cannot break down these vitamins, multiple times, you're not going to absorb them. And the B vitamins are crucial to the neural tube development, especially folate. So if you are not getting these vitamins or you can't break them down, for example, if you have the MTHFR gene, which is a genetic mutation, you cannot methylate. So you cannot break these vitamins down that are not methylated. Another trick is to look at magnesium. So if your elements, your minerals are made out of oxides, they are extremely hard to break down. And a lot of times this can be what causes your stomach to hurt when you take your prenatals. So you need um, a different form of magnesium, calcium, zinc. And these all look different for each of these nutrients. For example, I look for a magnesium citrate or glycinate instead of oxide. Look for a calcium citrate instead of calcium carbonate. You will not absorb calcium carbonate. Looking for a bisglycinate form of zinc instead of oxide. So these are little tricks and tips when you're looking at your prenatals. Also look at the other ingredients in your prenatals like that. It'll say like inactive ingredients and just make sure there's no colors or dyes. I had a patient bring in her prenatals and I don't remember where they were from, probably Walmart or, a big box store. And it had dyes, yellow 5 and red 10 and colors in it, which I am not a fan of. And I think there are so many um, toxins in these that you don't want to take when you're pregnant. Also, a lot of women will go towards a gummy when they're pregnant, which is fine, but just make sure it has good sources of these nutrients that you can absorb.
Do you have a favorite brand or brands?
I have a couple. I personally took Orthomolecular's prenatal, which is a physician order only product. So you can find this with your providers, or I know hometown pharmacies will carry it, that brand. I also love Parallel. This is a newer one, and it's spelled P-E-R instead of P-A. Parallel is divided into phases of your cycle and phases and stages. It is specific nutrients for each trimester, and then they have a postnatal vitamin and mineral too. So I really like that it is targeted support. I really love that brand. I do like Ritual. Ritual is another really good one. And I think another thing to look for with your prenatal is to make sure that you are taking DHA and EPA, which are your omega fatty acids that help with your baby's brain development. That's crucial when you're looking at prenatals.
Wow. Yeah. Well, thank you for sharing those brands because I feel like when even as you're talking through each of these, people are like, oh my gosh, now these are like 10 things I need to look at on my prenatal, and just to make sure that it's good quality, because this is when, we eat a certain way before we get pregnant, and then it's just like the eating changes because now it's not about us anymore. And so you just want to make sure that you're getting something good quality. I do want to make sure we spend some time talking about postpartum, though. You've been referencing this as the fourth trimester, so maybe share a little bit about why it's referenced as the fourth trimester. But this is an area where Dre and I, we could talk about this all day, because this is also a big passion of ours as well. But there is so much support during pregnancy. You have midwives and doulas and lactation and your OB and chiropractors. And yes, some of those people will stay with you in the postpartum, but it almost seems like it's like you have your baby and then, like, poof, the support leaves. So tell us a little bit about what fourth trimester really is, and then maybe how you support women through it, and what do you feel like they need more support in?
The fourth trimester is the time after birth and the 3 months after you deliver. I think this is a time when so much focus changes to baby. So it shifts to baby and supporting baby, and we forget about our moms. This is a time when moms are going through an entirely new beginning, right? This is our beginning. And this is changes in your hormones. This is, if you are breastfeeding, these are all different hormones that are produced to make milk. And I think too, after having a baby, you just lost everything you just created. And we go through so much depletion during this time as women. And you're focusing on keeping a human alive. And so we forget to drink water. We forget to take our postnatals or prenatals. We forget to shower. I mean, this is a time where you are so focused on your baby that we need people to focus on mom. And I think this is where you guys come in, right? We need providers that are checking in. And this is where I do think it's crucial to have a doula and a midwife on your birth team and your perinatal team to check in with you and see how things are going, and not to have to pack your 5-day-old baby up in a car seat and drive to your appointment wearing a diaper, and then sit and talk to your provider about how your baby's doing and how much you're bleeding. I think this is a time when your provider should be coming to you. And this is something I just really encourage women to have on their birth team and their pregnancy team, is a midwife and a doula that will be coming to them to check in on them. We had all 4 of our babies in the comfort of our own home, and we had midwives, and they were coming a day after delivery, a week after delivery, 2 weeks after delivery, and I think they did a 3 or 6-week visit as well, and I didn't have to leave the house. They came to me, and I don't think women know how relieving that is and how stressful it is to pack your newborn baby up and go to these appointments. So I really think just giving women options and encouraging women to have people on their team. These are people that you hire. Have people on your team to check in on you that are medically trained too, because your mom isn't always going to recognize the signs and symptoms of postpartum depression. And your husband is not going to always understand why you're crying over nothing, because as women, we know these things, right? We've been there. We've been trained to look for these things. And when I'm working with women in the third or the fourth trimester for postpartum adjustments, which I think are key and crucial to the healing process, I'm always asking them these questions and really gauging and watching, like, do they need more support than what I'm offering? Do they need a therapist? Do they need postpartum PT or postpartum training to help with pelvic floor and incontinence and other things like that that I don't think we're talking about enough?
And that's why we started Motherhood Alliance, right? Because there are so many arenas that women are needing support in, whether it's for themselves or for their little baby or for a toddler that, has now a rash, or just you're just always juggling and dealing with things that you're like, who can I talk to about this? And so whether you're in Wapaka area, obviously Dr. Alyssa is going to be a great resource. But if you're not in her area and maybe you're closer to Sheboygan or Fond du Lac or even just Appleton area, like there are so many people in the area where you can just use the website motherhoodalliance.com and just like find somebody that you need. If you're looking for a pelvic PT, find somebody close to you. So, a question here, Dr. Alyssa, is let's say tomorrow you found out you were pregnant. What would be your non negotiables?
My non negotiable is who you hire to be on your team. Your pregnancy and birth team is crucial to the delivery and care that you are going to get. So, really, again, looking at and interviewing providers that align with your values and your belief system is key. And I want women to know that you can have an OB and a midwife and a doula. They all do different things. I think doulas are maybe not fully understood what they do, but a doula is there to help with the emotional and mental health of you and your partner. And they really help navigate decision making because a lot of times your midwife is going to be busy doing the medical side of your care, whereas a doula will help you make decisions when you are asked questions and your husband is asked questions about, does she want this? Do you want this? How do you feel about this? Your doula can be there to help support because if this is your first pregnancy and birth, you haven't been through this and your husband hasn't been through this. So I hear so many women say, oh, but my husband's there. How many babies has your husband had? So I think really hiring somebody that has the training and the experience that has been through this before and has navigated different scenarios and different dilemmas and challenges that you want on your team, helping give you feedback and helping support your decisions when it comes to bringing your baby into the world. I think women have to do what they feel comfortable with. And if you are being intimidated or bullied into making decisions that fit your provider's narrative, that's not a provider for you. And remember, they work for you, you know? And when I go to take my car into the shop and they tell me I need a new alternator and timing belt and this, right? They give you the list and they say it's going to cost $5,000. I ask more questions, right? I get a second opinion and I say like, is this really necessary? And tell me how it works, right? So you really want to be asking questions and getting the breakdown. And if somebody is not giving you the answers that you are comfortable with, you find somebody else because you are paying them to work for you.
Yeah. Biggest non negotiable. I love how you're just like hitting that home because it really does matter. Going back to like your business in general, are you on social media? Is there a way people can follow you?
Yes, I do post a lot of free information for Roots Wholistic Health on Instagram and Facebook. I really like to tag or send links to my favorite products. If I find things that I really am passionate about and love, I will share them, right? I think social media is a great way to share information. And I also have links on my website to my favorite Amazon products. You can access that through rootswholistic.health.com. But all my handles for Roots are Roots Holistic Health, and that's on Instagram and Facebook. And holistic is spelled with a W because we look at the whole system. When it came to social media for Find Your Fertility, I really struggled with it because Find Your Fertility is not a brick and mortar. And I was posting a lot on Instagram and Facebook with Find Your Fertility, and I just really felt like it was not reaching the right people. I had a lot of people reaching out from across the country wanting virtual consults, and that's not what Find Your Fertility is designed for. It's designed to share information and for women to take online courses to gain more knowledge and education. So I switched that platform to Pinterest. So if you are looking for more information about Find Your Fertility, I use Pinterest because it's a search engine. It's a search platform and it is findyourfertility.live. instead of .com. And those are the platforms that I share.
Great. Thank you for sharing all of that. We are going to be fast forwarding in life a little bit to perimenopause for our last conversation. So I love that you're covering the whole gamut, right? We can't wait for that one as well.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.